From the outside, you'd never know.
Jumper Auto Parts, Eric.
Low wheel if you got it.
Eric Dingley is gainfully employed,
What are you working on?
a family man, active in his church, and happy to help. But it's the pressure of helping others that made him the needy one.
I mean, you are enslaved to something totally, and you want to be free of it, and you try your hardest to get off of it.
He's talking about pain pills.
I work on my feet all day long. I was taking care of my mother with Alzheimer's and my handicapped daughter. Our morning started early and ended late, and I basically looked at them as being my Superman pills. They didn't affect how I acted, but they kept my legs strong and young.
They don't feel as guilty, and they don't necessarily see something wrong with it because, hey, I got the prescription for it. And take a deep breath.
Dr. Monty Singleton of Orangeburg is Eric Dingley's doctor. A big part of his rural practice is treating pain pill addictions.
Many of the people who are addicted to the pain pills have jobs, go to work every day, may be sitting next to you in church, and you would never know it. Now come back up, now bend to the left.
And in this practice,
and bend to the right.
it seems everyone has a story.
Or just stiffness.
Broke my back, and then being prescribed prescription medication, and then Oxycontin came along.
35-year-old Kevin Turner says that was the start of a 15-year spiral.
You think you're still hurting and you don't want to wait that extra 2 hours to take as prescribed, and you take more and more, and then it's a snowball effect. And then before you know it, you're out of medicine, and then you're looking for more on the street.
And the addicts we talked with say in South Carolina, the street sellers may be as unsuspecting as the buyers.
Sometimes it's people that can't afford just the necessities of life, so they sell their medication. Sometimes it's people that are taking the medication from their elderly parents and selling it because it's a very lucrative market.
I had a patient who came to me just as a new patient last week, spent $285,000 last year.
Singleton says what he loves about his patients is that they want help.
You reach a point and you go, man, I don't want to be here. This is terrible. I'm spending money I don't have, and you know, just to be normal, just to work.
First day I came here, when Dr. Singleton walked in the door, I grabbed him and I hugged him. I was crying. I told him I'm sick and tired of being sick and tired.
That sounds good. Sit yourself back up. Good, good, good.
So he started treatment, which includes a newer medicine that suppresses the cravings. Says he's begun to feel like his old self. He's on the same drug Eric Dingley was prescribed.
When he told me about the Suboxone, I said, well, how quick does it work? He said, immediately. I said, well, that's great. How does it make you feel? He said, I don't know. My patients tell me it makes you feel normal.
And he says it did. Helped wean him off of the pain pills. Now he's off of Suboxone, going on 6 months of being clean.
Yes, sir, we can fix you up on that.
Says he still has the same stresses,
Okay, will do. Thank you.
but he continues to push the pills away. And things are finally as they appear. Pretty proud to be where
Oh, man, absolutely. Absolutely. It was I would never wish it on anybody, and I never would have planned it for myself, but if I can use it to help someone else, then I guess I'm glad I walked that path.